Hello there. Pacemaker implantation is a procedure that is done under the local anesthetic most of the time. This is done on people who have problem with their heart rate or rhythm. There are people who have very slow heart rate or sometimes their heart stops for a few seconds. This is life-threatening. It is diagnosed with a number of tests. However, once a diagnosis is made, then the operator, the cardiologist, would advise you that you must have an implantation of the pacemaker device. It's usually done from the right side, and we give a small nick on this side and we make a little pocket under the skin. The pacemaker sits in there and it's attached with a very long lead, just like a rat's tail. This tail goes into your heart and sits in the chamber. What it does, it senses if your heart is going to beat or not. And if it senses that it's not going to beat the next beat, then it will generate an impulse and makes your heart beat so you don't miss any. This is a savior in terms of these bad heart rhythms. As I said, it's done in the local anesthetic, and once it's done, they stitch it with a few stitches at the top of the skin, which has to be taken out after 7 to 10 days. It is done under it is kept usually under the regular follow-up, and you have to have your pacemaker checked every month initially and then every 6 months to make sure that you've not used all your battery. The battery tends to last, depending on how much your heart uses it, but most of the time it lasts 5 to 10 years. At the end of that, or before that, we change the battery again with the same procedure, except it's a smaller procedure. And that's about it. Many thanks.